watching. I apologize for the horrible lighting, but I've been in the clinic. Lately we've been doing like 12-hour days, 13-hour days, just so much going on. But I wanted to expand on something I talked about last week when I suggested people use clinicaltrials.gov to find studies for themselves or find jobs for themselves if they're looking for work. In this video, I want to expand on that. So there's different ways to go about it. First of all, this is going to apply to job seekers. This is going to apply to research sites looking for studies. This is also going to apply to research sites looking for physicians, and anything else like BizDev, whoever you're trying to target. Okay, so there is the mass mailing approach where you build up an email list and you market to them, and then there's the slow approach where you really pay attention to who you're reaching out to and you give them a proposal, a customized proposal, one where they can tell that you've put some thought into it. Okay, both work, both are effective. Obviously one takes a lot more time, and you want to make sure that you're choosing the right leads to spend that much time on. Okay, but both should work. So here's an example. If I'm a research clinic and I'm looking for a physician, okay, in my area, let's say I'm in Dallas, Texas, I can do Craigslist ad, I can do Indeed.com, I can even do LinkedIn, and then I can individually call those people or email those people who respond, tell them about research, tell them why they should work with me, etc. Right? That works. I can even go a step further and have a one-on-one conversation with that PI and explain to them how working with me or my clinic is going to benefit them. Same thing if I go in person at their office and have a face-to-face. Okay? That's the slow cooking versus the microwave strategy I'm about to give you now. So I'm not arguing which one's better. They both work. There's a time and place for each strategy. Okay, so those are good when you've narrowed down your selection to someone you think might be interested, or quite frankly, you don't have a lot of leads to go after. All right, if you need a PI and you only have 5 leads that responded to your ad, there is no mass mailing. It's one-on-one until you find one that works, and if it doesn't, then you repeat. Mass mailing, very different. And there's even, actually I should go back, there's one step more than that, is sending them a handwritten follow-up letter or a thank you letter after the conversation. I mean, this is really like slow, old-fashioned, the way to go. Again, there's a time and place for that. I was telling one of my students, do you know how many emails I receive a day? Do you know how many phone calls? Each one was slightly less than the former. So a lot of emails. I try to respond to most of them. A lot of phone calls. I get back to most of them eventually, if not all of them. A lot of texts. I get back to all of them. Zero letters. 0 letters, handwritten letters. Forget about on a daily or weekly basis. On a yearly basis, I get 0 letters written to me. You know how many of those handwritten letters I would actually read? All of them. You know how many I would respond? I would feel obligated to respond. So the slow method works. Now the fast method is, let's say you have an assistant or someone, or you yourself just Google in Dallas, let's use this hypothetical situation, all the physicians you can find. There's places where you can find a list of physicians, or you just Google and get every single physician's email address, and you build a 400-person email list, right? That's a lot, but you have a 400-person email list. You can then send a mass email. You can use any type of, there's plenty of mail programs. One that I use, I have 2. So one for my blog is Aweber, A-W-E-B-E-R. But the one I use for prospecting, that's more to follow up with my audience. The one I use for prospecting and BizDev is called YAMM. It stands for Yet Another Mail email plugin, and it lets you, for I think $14 a year or something ridiculously cheap, send 400 emails a day. A day. Okay, that's a lot of emails. So if you do that, and again, it's harder to collect the 400 emails than it is to send it out. Now you can buy these leads, you can have an assistant just Google everyone in your area and put these people on there. You can go on LinkedIn and get their emails. Now you send the mass email. You have a short pitch with a link to your website and a call to action. Reply back or fill out this form if you want to learn more, and I'll reach out to you to discuss research. Okay, from those 400 emails you send out, you should get like a 20% open rate, and then maybe a 10% click-through rate, which is still 40 leads. Okay, and maybe one or two of those will actually work out for you. So same exact process I just used, or I just discussed, for finding a physician for your clinic can be used to find studies for your clinic. Okay, in fact, it's even easier to do this because it's a lot harder to get 400 physician emails than it is to get 400 study leads. You can get those on clinicaltrials.gov in an hour. Okay, I mean, you literally type in what kind of studies you're interested in and get the study director, project manager, medical monitors emails, put them on an Excel sheet, mass email them all, and do this every day. You can send up to 400 a day with YAMM. If you want to pay more, you can send more, but 400 a day is more than enough for our purposes. I don't do 400 a day. I probably do 400 a week. For my CRO, I probably do closer to like 800 a week. But yeah, so that's a way to do it, okay? And now, same thing if you are a job seeker. Okay, oh, and by the way, for the sites that are looking to get studies, the ones that reply, they're interested, right? Now you send them everything they want to see. You send them a very detailed email with site performance, prior metrics, how you did on previous trials, how many you screened, randomized, screen failed. Then you do the same thing on a flyer or on a brochure. Costs a little more, but and then you mail it to these people. Okay, just do this consistently and you will get more business, right? So the slow method and the fast method, they both work. They both serve different purposes. Finally, if you're a job seeker, what I just mentioned will work for you as well. So you build up a database and you email them all, okay? And then when they reply, you customize a message to them because you're going to do some research on them now, see what they need, what your strengths are, where there's some possible synergies. You communicate that, and then you also send them a handwritten letter, which, by the way, the handwritten letters is something I used to do when I first got started in this industry with my research site looking for studies, and it's something I need to get back into doing. I'll be the first one to admit I don't write handwritten letters, but I think it's time we start doing this again. Time to go back to the old school, because, like I said, all these methods work, and you should use all of them, okay? So hopefully that helps just a little bit on biz dev and on prospecting and clinical trials, and I'll figure out what title this video will have. But try this out, let me know how it works. Talk to you soon. Bye-bye.